Every month, being a member of the American Psychiatric Association, I get a cool journal called the American Journal of Psychiatry with a bunch of cool articles on it. One of the articles this month was Doxycycline use in adolescent psychiatric patients and risk of schizophrenia. Now, doxycycline is a pretty old antibiotic. It's a tetracycline antibiotic. And one of the most common reasons it's prescribed today is for acne. So people who have acne in adolescence, they'll tend to be on this medication. Now, to be honest with you, doxycycline has some pretty nasty side effects. It can cause sun sensitivity, it can cause esophageal irritation, sometimes leading to worse things for the esophagus. So going into this article, I was ready to read about how doxycycline is a precursor, increases the risk of schizophrenia when used in adolescents. And would you look at this? In the results of the trial, the risk of schizophrenia after 10 years of follow-up was 2.1% for individuals who had used non-doxycycline antibiotics. In comparison, the risk of schizophrenia at 10 years was significantly lower in adolescent psychiatric patients treated with doxycycline. Low cumulative dose, 1.4%, risk ratio 0.7, and a whole bunch of other statistical numbers here. Now, the important thing to know about doxycycline is that it permeates the blood-brain barrier, so it gets into the brain. And the supposed or proposed mechanism of action of why it helps with the delay of developing schizophrenia or the protection against schizophrenia is that it modulates what is called neuronal pruning, and excessive neuronal pruning in adolescence is proposed to lead to the development of schizophrenia. This is fairly exciting for a bunch of reasons, but honestly, one of the main things that make it more convincing than not, and I will speak from my bias as somebody who is a doctor and in medicine, is that typically fantastical studies are produced and funded when there's a lot of profit to be made from a medication. Doxycycline is like totally off patent. There's nobody making money on it. So when I find like an old medicine being researched for positive outcomes, I tend to kind of believe it a little bit more. Anyway, that's my own 2 cents. I thought that was a very interesting article, and yeah, let me know what you think.